The third article in the Go With Them magazine features Natalia Seijo's Reconnecting with Body, EMDR and Complex Trauma. Natalia Seijo offers insight on how unresolved complex trauma manifests physically and how EMDR therapy must be adapted to help clients safely connect with their bodies. According to the AIP model, trauma is not just a narrative memory. It is deeply encoded in our implicit somatic and autonomic systems. So in the case of complex trauma, especially those involves chronic abuse, neglect, and attachment disruption, the nervous system learns that it is not safe to feel or inhabit the body. This connection is shaped not only by the abusive events that happened, but also by what didn't happen. That is the absence of emotional attunement and then co-regulation that didn't happen during the abusive events. As a result, disconnecting from the body emerges as an adaptive survival strategy. So Seijo noted that bodily disconnection typically presents in two distinctive forms. The first one is what's called the somatic dissociation. That is, the body remains acceptable but expresses unresolved trauma through physical symptoms such as pain, numbness, fatigue, or gastrointestinal distress. And the second one is somatic dissociation. This is a more profound disruption when the individual lacks access to their bodily sensations altogether, feeling that their body is distant, unreal, or not mine. So to treat this effectively, EMDR must shift its focus from reprocessing a single traumatic event to increasing the nervous system's capacity to tolerate internal experiences. So phase two, the preparation phase, must be significantly extended because the body is not initially experienced a safe tradition. So traditional safe place exercise may not work. Instead, the therapist must use gradual somatic resources. This might involve developing a calm place anchor reinforced by placing a hand on the chest, rubbing the thighs to regain awareness, or grounding through the feet and the chair. So moving into the reprocessing phases will require extreme care. Therapists must rely on microprocessing instead of full exposure and using very brief, carefully titrated sets of bilateral stimulation. The therapist must frequently pause for grounding and continuously monitor for signs of dissociation to prevent overwhelming the client. Moving too quickly can exacerbate somatic symptoms and trigger a system shutdown or further fragmentation. So when EMDR is properly paced and relationally attuned, then improvement is often subtle but deeply meaningful. Some early changes can include reduction in extreme dissociation and slight increase in body awareness. Ultimately, the client will gain increased autonomic flexibility, the ability to tolerate emotions physically without shutting down, and a restore integrated sense that their body safely belongs to them. And a bottom-up approach is a clinical method when the therapist uses present-day bodily sensation as an entry point for trauma processing. So instead of starting with a visual or narrative memory, the first level begins with the body as the primary entry point. Instead of asking the client to recount a visual or verbal memories of a trauma events, the therapist will anchor the work in present-day bodily experiences, such as numbness, fatigue, or chest tightness. Then the therapist leans into these physical symptoms by asking a bridging question. If the sensation has a memory or a belief, what might it link to? And this question will gently move the client into the second level, where the physical sensation bridges into an associated emotions. Because the body holds the implicit learning of past relational trauma and developmental neglect, focusing on the physical symptoms safely draws out the hidden affect, such as profound sadness, fear, or sense of isolation, and the body has carrying in as a survival strategy. So finally, this emotional connection unlocks the third level, the activation of the underlying implicit memory network. By traversing from physical sensation to emotions, the client's nervous system safely accesses the deeply encoded memories and the core negative beliefs that were previously locked away. So ultimately, this three-level bottom-up approach allowed the therapist to bypass cognitive blocks using the body's own procedural memory to safely access and heal profound developmental wounds.